Welcome to week 2 in our study, reflexology. I know many persons have been in a wonderland as they are now realizing how important and beneficial reflexology has been, as they would have heard of the testimonies that would have come from reflexology. This evening, we are also in for a treat in module 2 of our reflexology course. This evening, we're going to be looking at the anatomy of the feet. The anatomy of the feet. And we're going to see how reflexology is very important as we study the feet. As I told you last week, to take your feet in your hands and look at it. And the feet tells a lot about the owner of the body. And so this evening, we're going to look at the structure of the feet. We're going to look at the different parts of the feet. And we're going to also learn new medical terminologies as it relates to the feet. So this evening, we have the bone structure. I'm going to see if I can share my screen with you so you can have a better view of the bone structure of the feet. All right, let me share that screen. All right. So when you look on your screen, you'll see these are the different bones that make up the feet. So though we just get up every morning and we walk, we don't realize the scientific makeup of our feet. You see the tibia, the fibula, the tarsals, the metatarsals, and the phalanges. These are parts of the feet. The bones of the foot provide mechanical supports for the soft tissues, helping the foot to withstand the weight of the body while standing in motion. They can be divided into 3 groups. The tarsals, a set of 7 irregular shaped bones. They are situated proximally in the foot, in the ankle area. The metatarsals, they connect the phalanges to the tarsals, right? So they're the in-between. They are 5 in number, 1 for each digit, 1 for each toe. The phalanges, these bones of the toes, each toe has 3 phalanges. We call them joint if we in our own term. Proximal, intermediate, and distal, except the big toe, which only has 2 phalanges. The foot can also be divided into 3 regions: the hind foot, the talus, and the calcaneus. And I want for you to get in your research and begin to look at the foot in a more detailed way. Spend time with the feet, with diagrams of the feet, and absorb as much as you can. So in this article, we shall look at the anatomy of the bone of the foot, their bony landmarks, articulations, clinical correlations. And so you're gonna, as we study, we're gonna spend time learning the feet and understand the different makeup and why they're there. So the blue area is called the tarsals. 7 bones make up the ankle. Can you imagine? You're walking and don't realize there are 7 bones in the ankle, another 5 in between, that's 7 and 5, 12. And then the 4 of the toes has 3 bones, 4, 3, 12. And the big toe has 2. So 7 and 5 and 12 and 2. That's the amount of bones that make up 1 foot, all right? We have them in colors again. So we see the calcaneus is in yellow. That's the one that connects with the leg. Then the talus bone, then the cuboid bone, navicular bone, and the cuneiform in green. So each of them are given different names and there are colors there so you can better have an understanding of what you're working with. We are fearfully and wonderfully made. Then we look at the muscles that make up the feet. So we see on the first chart, You have the plantar fascia. So you see, that's the ligament that joins the feet together. So you know that we have muscles, we have ligaments, we have tendons, right? So you have the ligaments and the tendons that join bone to muscles and bone to bone. And so if you notice on the chart, you see the muscle is stretched from the heel all the way up. And then you notice that the ligament and the tendons, they're stretched from heel to toe to keep things together. So we see that there are some very long tendons in the bottom of the feet. And that's why when we begin to do the physical touch of the patient, we will know exactly what is under the feet. And so when we begin to feel abnormal, like balls and grains and lumps, we know definitely that something is not going right with this particular client. And so it is very important for us to spend time looking at these charts, because sometimes the patient will come and tell you that they have this particular tendon issue. And so you will have to have an understanding as to what they are talking about. So you will get this particular PowerPoint where you can spend more time understanding the feet and how it functions. Bone connect to bone, muscle connect bone to bone, ligaments and tendons, allowing everything to flow together. The muscles acting on the foot can be divided into two distinct groups, extrinsic and intrinsic. The extrinsic muscles arise from the anterior and posterior and lateral compartments of the leg. And so post is whatever is behind, anterior is what is in front. Think of the chest, right? Anterior chest is the front of the chest. Posterior is the back. We have that for the lung as well. That's why when you go to the doctor, you notice that they're not only checking front for breathing, they also put their machine or their device and stethoscope, and they check your breathing to see what is happening in the posterior lungs. They are mainly responsible for actions such as eversion and inversion, flexion and dorsiflexion. So it means that these muscles allow you to turn the feet in, turn the feet out, flex them, dorsiflex or plantar flex. And so you learn these terms as you continue in your course. The intrinsic muscles are located within the foot and are responsible for the fine motor actions of the feet. For example, movement of individual digits, movement of individual toes. So those are the intrinsic muscles. Don't get all flustered with these names, but knowledge is power, so that when the patient or somebody in the medical field comes to you and they're speaking the language, you're able to understand. So you need to read more, watch more videos as it relates to the anatomy of the feet. While you're cooking, while you're cleaning, put your earphone in and cause it to soak, right? We look at the nerve supply of the feet. Now we are fully wired. So we see that we have nerve supply running through the feet, nerve supply running from the spinal cord in the back all the way down to the sciatic nerve, all the way down to the feet. Then it branches off into many different nerve supply to give the feet its sense of feeling. So when you touch someone, the nerve can respond that they are being touched. You're able to know the difference between hot and cold and warm. And that is part of the function of the nervous system. But we are doing just the anatomy of the feet just now. But I think it was important for you to understand not just the bones that make up the feet, but that you get an introduction to the nerve supply also in the feet, because this is where we're going to be spending 99% of our time when we are seeing our patients. So we see that the supply of nerve runs all the way through the medial plantar nerve. If you can see on the right side is the top of the feet. These are the areas where the nerve supply runs down all the way from the brain to the spinal cords to the feet. So everything is connected. So when you touch certain parts of the toes, you are literally giving a response directly all the way back to the brain. And when we learn about the pineal gland reflex, the reflex for the mouth, the nose, we realize that we are in the supply zone of these parts of the body. A nerve is a primary structure of the peripheral nervous system. Pay close attention to that phrase, peripheral nervous system. Peripheral means the feet or the hands, okay, peripheral. A nerve provides a structured pathway that supports neuron function. A nerve consists of many structures, and you're going to spend time learning these words and understand what are these nerve structures. The axons are bundled together into a group called fascicles, and each fascicle is wrapped in a layer of connective tissue called the perineurium. Don't worry about these big words. You just need to have knowledge. MRI machines, they are used to detect nerve damage, magnetic resonance neurography. And so these are used to detect when there's a nerve damage. And so they're able to help the patient to better understand what is happening, especially with a patient who has diabetes. They often face a lot of nerve damage. The foot nerve originates from a sciatic nerve made up of lumbar 4 and S3 nerve roots. We learn the codes as we go along, because when we go to the nervous system, we realize that they shorten the name of lumbar and they call it L4. There are more than one lumbar nerve point, but when we get to the nervous system, we will look at that, right? The sciatic nerve, which provides motor innervation to the muscles of the posterior thigh and sensory innervations to the lateral side of the lower leg. Remember now, posterior, lateral, the lateral is the outer side of the leg. Posterior is where you're at the back of the leg, all right? And so these nerves, the innervation of the lateral side of the lower leg and the lateral side and the sole of the feet ends just above the posterior knee. And so these are all medical terms, and it is just giving you some direction as to where the nerve runs from one part of the body to the next, all right? So you understand that the feet is not standing by itself. It is connected to somewhere else. So basically, this chart is what it is talking about, how the nerves start out and then it branches off into other parts of the feet, and then it branches again down from the posterior all the way down to the feet. So it's going from the back to the front. And also from the front, you notice it branches off down into the feet. So if you look at both charts, you see exactly what it is saying to you, that the nerve supply spreads throughout the feet. And that is why a reflexologist is very important in the life of human beings, because we are able to go and touch those feet and help to stimulate the nerve pathway and to help our patients to have better supply. If the nerve supply is good, it will also help the circulatory system. So if your circulatory system is not functioning at its peak, chances are the nervous system also is having an issue, because they flow together. It's like a motor. It's pushing the blood forward. It's telling the body, do this to the body, get rid of this, do that. Even for a bowel movement, you need your nervous system to be up to par. You need your circulatory system to be up to par because peristalsis must take place as the body move feces out. We are fearfully and wonderfully made. We look at the blood supply to the foot. And just as if you look on the nerve supply, you're now going to realize that that means the nerve supply and the blood supply, they are flowing basically in similar patterns to get the foot functioning in its right capacity. And so we see the supply to the bottom of the feet, we see the supply to the top of the feet. So we see the sole of the foot on the right, and on the left, you see the top of the feet in this chart. It shows you how the blood flows and the arteries and the veins, how they flow to the feet. And so oxygen is coming from the lungs, from the heart, down on the left, and it takes the deoxygenated blood and bring it back up. So on this chart, you're seeing blood supply coming from the heart to the feet. So can you imagine the feet of someone with diabetes or circulatory issues? Supply would be limited. Some persons' supply have been cut off, and so they have to amputate leg or amputate toes. What if, as a reflexologist, you could have intervened early when the patient tell you that they can't feel when you touch that part of their foot? You could have sought medical help for them. Doctors could have intervened and they could have gotten help to save a foot or save a toe. That is how important a reflexologist is in the life of individuals. Very important. And so the plantar arteries, they run lateral, medial, and deep. They form a looping web of arteries across the foot and down through each toe. They eventually unite with the dorsalis pedis artery. That's a pulse point at the top of the feet, the dorsal side of the feet. This artery supplies blood to the surface of the foot as a continuation of the anterior tibial artery. And so when we look on the feet, the dorsal is the top of the feet, there's a pulse point that the podiatrist, that's the doctor who studied the feet, they are able to use that pulse point to tell if blood supply is flowing at the right amount to the feet. For example, pulse points tell a lot of information about the patient. So when I am doing a session, sometimes I'll stop and I will test the pulse point at the dorsalis pedis. I'll show you as we do our practical where this point is. And you will literally sometimes feel the patient's feet throbbing. And sometimes I stop, look at my clock or the clock on the wall where I'm treating, and I will count to see if I get 60 to 100 beats per minute. If it's less than 60 or if it's over 100, then I know something is wrong with the patient. Some patient might be having a heart attack or about to have a stroke. And these things you can pick up quickly through a reflexology session. Students, you will research medical conditions that affect the feet. I'm going to give you some, but there are many medical conditions of the feet. And this is what you would need to know, because if the patient have certain things happening to their feet, then you'd have now referred them on to a podiatrist or a surgeon, because you would have not touched the feet if you notice that the feet had certain conditions that would have been contagious. So I want you as a personal duty to research medical conditions that affect the feet, because one of the things in your practical, you will need to be very observant of your client's feet. So while you're preparing and you're sanitizing that foot or the feet, you're also taking note as to any medical issues because you'd have now researched and studied that there are some things that are happening to the patient, especially if the patient is blind, if the patient is elderly, and if the patient has diabetes and cannot feel. You will have to be that person who advocates for the patient. So we're going to look at athlete's foot. The patient will say their feet is itching, stinging, and sometimes burning between the toes. The contagious condition appears after you make contact with a fungus, usually wet environments such as locker rooms, public showers, and swimming pools. It's telling you how people can get athlete foot or wearing someone's shoes who had that condition. You may experience foot blisters, crumbly toenails, and cracked, dry, and raw skin on your feet because of athlete's foot. You want to work on a feet that is free from all of what I just said. And yes, if you should see a patient and you notice between their toes are white, then you wouldn't work the reflex point in the toes, which is the lymphatic reflex point. So you'd work away from it, because sometimes I work on patients and then I realize that maybe just one toe is looking a little white. You can also encourage a patient to use like eucalyptus and cotton and put in that area. Different home remedies can be used, and we'll definitely be looking at some of them as we continue our course. Blisters, raise pockets of fluid on each side of the foot, or raised pockets of fluid on your feet are known as blisters. This painful condition can be caused by walking or standing for long periods of time, wearing ill-fitted shoes, or having sweaty feet. Generally, blisters aren't serious condition and can be treated at home. Try to let the blisters heal naturally and give yourself relief by applying a bandage over it for comfort. That is what you tell your client. Only drain blisters yourself when necessary, and do it with proper sterile equipment. If you choose to drain blisters, make sure you keep it covered with a bandage or an antibiotic as it heals. So in my kit that we look at, I sometimes keep foot ointments, Band-Aid, creams, so that I can sometimes intervene and help my patient. Because sometimes they're living far from medical help, and you can carry a first aid kit within your foot supply. Bunions. It's a bump on the side of the big toe. This condition in which your big toe bends towards your other toes can make it painful to walk. It may cause inflammation and irritation on your big toe or your second toe. Bunions may be a result of foot structure you inherited and or tight or ill-fitted shoes. Standing too long may aggravate your bunion. So you need to get proper fitted shoes, and you'll see your specialist who will give you that special shoe, or you get over-the-counter pain reliever to help whenever the bunions act up. Corn. Round circles or thickened skin on your toes or the sole of your foot. Your body forms corns to prevent blistering on your foot, so it's like a defense. And then it can become very painful. But one thing I know for sure, some hard areas under the bottom of the foot is just the body's protection to say, especially where the shoulder reflex is, that the owner of the body needs to rest. I am stressed. So the feet is saying, this person needs a good deep tissue massage. And so these are some of the things that can affect us as we age. It can affect us as the shoes we wear. So we want to ensure as therapists that we are able to help our patients to better manage their foot condition. And so remember, you will research the different conditions of the foot. Today, I want to look at the toe and all the reflex points or the organs that are also connected to that part of the foot. It is very important that we understand each reflex point and what it is connected to. So I'm going to be telling you just to look at your big toe for argument's sake. I hope I can get this particular chart up. Let me see if I can share it. Okay, yes, it's gonna allow me to share. All right, so it's my little scrap book that I am using to make simple. You will get a blank copy of this foot chart. In your final exam, you will have to know each part of this chart, which is when you're finished your practical. So this will be done when you're finished your clinical hours. However, don't be flustered. I will put it in regions. So I'll be putting the body in regions, so you will not have to do it all at once today. So now, in yellow is the reflex points of the toes. And so the international standard, we see the feet, we have a number 1. Number 1 is the pineal or pineal gland reflex point. So the feet represent the face, the brain. So that is where you'll find the reflex point for the pineal gland. All right. So it is right in the inner part of the toe. That's 1/3 down from the inner part of the toe. This point is found, known as the pineal gland. This gland is in the brain, and when we do the central nervous system, we're going to look fully at the organs that are, or the glands that are in the brain. All right, so that's one of the glands. The next one is the pituitary gland, and it is numbered as number 4 on the chart. The pituitary gland. These are glands that help with hormones in the body. And so the pituitary gland is the master gland of the body. I'm going to ask all of you to say that word, okay? And so that gland helps to control even your period, if for those who are having their monthly period. That gland helps to control menopause. That gland helps to control pregnancy. That's the master gland of the body. And so as we begin to work on women who have period issues or infertility, those who want to have children, that's one of the glands that you stimulate, because most time it's a hormone deficiency that is affecting the woman from conceiving. Then you also have on this chart the brain reflexes. So the brain reflexes is coded as 32. So it is coded as number 32. And so when a person are having headache, like today, I was having a major headache. The time was very hot. I came in, I draw the curtains, I turn off the light, and I made the AC very cold. I turned the AC up to the maximum just to see if my body could relax. And my daughter came in the room, and she know that once I'm having a headache or any pain, I'm gonna say, touch my foot, please. So I had on my socks. So she was doing her reflex points through the socks. I said, you know better than that. Take off the socks and touch my feet. I said, I need to check myself to get a reflexology. She said, pay me and I'll do it for you. And so she reflects just the brain area back and forth as you do the brain area, as you learn the reflex points, 3 ways, 3 points this way, 3 points the other way on the top of the toe. And here my teaching class, I'm feeling much better. And as I would have shared, of persons would have come with headaches at maximum, I had to turn off the lights. And by the time I was finished, they were able to have the lights on and get back to work. we have the reflexes of the eyes. So toe 3, 2 and 3, the eye reflexes are located right there in the center of toe 2 and 3. All right. Then you have the sinus reflexes. The sinus reflexes are the second points below the brain reflex. That is a sinus. See, I have it over this side. The sinus reflexes are right below at the ball of all the toes. So a person's come with heavy mucus draining, you stimulate that. Sometimes you feel like a ball, like you're stimulating a ball-like feeling. But you keep doing it. Sometimes you can have more pressure, depends on how the patient can manage your pressure. But it's a pressure point therapy. Don't break their toes now. And so I've had patients who came just for sinus issues. I stimulated the sinus reflexes. I allowed them to inhale eucalyptus oil or peppermint. And when I was finished, I had to give them napkins because they said the mucus was just running out. All right. Then you have the hypothalamus reflex point, and that is point number right here. This one right here. It's point number 5. See, like a point, yes, point number 5. It's clearer on this on the left side. It's like a line right there. This is one of the glands in the brain, and it helps to control temperature. So when person are having fever, the baby having fever, I would normally stimulate that gland to help the body to fight. You're going to research and read each of these glands, how important they are. When you read and understand, it makes your therapy even more interesting than just for the teacher to show you where to find this or where to find that. If you understand the structure of the feet and the organs and their function, then when the patient comes with malfunction, you will know how to stimulate the body to say, get to work. Then we have a nose and mouth reflex. Yes, patients who couldn't smell because of sinus issue, I would have had to stimulate these 2 points right here, which represent the nose and the mouth, right on the outer part of the feet. So the top one is the nose, which is point number 2, and then number 3 is the nose. So today, you're learning the reflex points that are in the toes. So right away, you can start working on people with headaches, toothaches, period issues. Just start stimulating those points. And then for the brain, you walk the reflex of the brain. For the eyes, you hook and circle and do your hand in a circular motion. For the points in the feet, in the toes, you do like a hook and stimulate. Depends on the angle that you can manage to hold the patient feet. So you stimulate the point, or you put it above and you do a hook. So these points, you wouldn't walk, you hook. And you also have person with toothache. So right where the phalanges meet the metatarsals, rewind the tape, you will see that just above that, you have the nerve reflex points for tooth. I've had one sister who had a toothache and she didn't tell me. She was hiding the pain, but while I was doing the treatment, she surrendered because the feet speak, okay? So these are the areas that you can start working on now, the eyes. I found out my kids need glasses, doing their eye reflex. They were crying. Took them to the ophthalmologist. Their vision was at 20/40. That means when they read, it has to be magnified twice the size of the normal person's vision. Okay? We can help our children. I have had to work on children who are deaf. They still need to read. And so I was able to intervene and get them their prescription glasses. Many patients who came to me at Howard's Medical stimulated their eye reflexes, major pain, never wore glasses, sent them to get their eye tested. The next time they came back for treatment, they were wearing their glasses. You can intervene because reflexology works. Practice, 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 and rewind the state as often as you can. You'll get there. See you in week 3.